Call 6 Investigates is digging into concerns that the state could do better to make sure people with disabilities in Indiana are treated fairly amid this pandemic. Our Kara Kenny found out what groups are doing to ensure people with disabilities are getting life-saving treatments.
An estimated 1 million people in Indiana are living with a disability, and advocates want to make sure they're treated fairly when it comes to COVID-19. Sean Fulton is an adult with a disability living in central Indiana.
But I do have a slow learner. I have an anger issue.
He's practicing social distancing and worries about getting COVID-19.
Thank God I haven't gotten any symptoms or anything. I'm doing what they say.
Sean works for the Arc of Indiana, an organization that is working to make sure that people with disabilities like Sean are treated fairly if they're diagnosed with COVID-19.
History, unfortunately, has always been that, the value of people with disabilities has not always been seen as strong.
Indiana has not had a shortage of ventilators, but some are concerned about what could happen if doctors have to make difficult decisions. Indiana Disability Rights wrote this letter April 16th to the U.S. Health and Human Services Agency, urging them to put pressure on states and hospitals so that people with disabilities are not denied life-saving treatments. They're also asking states like Indiana to track whether a patient has a disability, much like they track race and age. Call 6 Investigates found Indiana's COVID response plan does not include ventilator triage guidance. Hospitals make those decisions.
What we need to make sure is that hospitals and medical personnel are making decisions from a medical perspective and not from a value-based judgment perspective. And so we're trying to work with the Hospital Association to see if we can get some of the policies changed to reflect that.
We reached out to the Indiana Hospital Association, who told us hospitals do not base allocation decisions on a person's relative worth based on the absence or presence of disabilities. Sean hopes hospitals stick to that policy.
Being equal, it would be the key word there.
If you or a loved one feel you've been discriminated against, you can contact Indiana Disability Rights. We've included links on how to do that in this story on the RTV6 app and the IndyChannel.com. Reporting in Indianapolis, Kara Kenny, RTV6.